Hi, I'm Dr. Shobha Badiger. I'm a senior consultant in Pediatric Haemato-Oncology and bone marrow transplantation. I work in Narayana Health, Bangalore city. So, what is blood cancer? So, the word blood cancer in medical terms is called leukemia. There are different types in this: B cell leukemia, T cell leukemia, acute myeloid leukemia. These are the medical terminologies for blood cancer. In whom will blood cancer come? Will it happen in children also? Yes, children also can be affected by blood cancer, and there is no age limit. Any age group can be affected with blood cancer, that is leukemia. It can be boys, it can be girls also. How do we know that a child has blood cancer? So, the most common symptom of blood cancer is just fever. The child may have only fever, which is not coming down with regular medications like antivirals or antibiotics, or you give paracetamol, still the child keeps getting fever every now and then. Most viral fever or bacterial fever, when they start the specific medication for the fever, it comes down in a week's time. But blood cancer, unless they are treated with chemotherapy, the fever will not come down. So any fever which lasts beyond 1 week has to be tested for cancer, in addition to other causes of fever. Now, the other symptom is the child could have severe anemia because the hemoglobin will be low. They can have small bleeding manifestations either in the skin in the form of red spots or bleeding from the mouth while brushing their teeth. So this is because the platelet will be low in blood cancer. In some children, there can be swellings in the body. These are called lymphadenopathy. There are normal lymph nodes which cannot be felt normally, but in blood cancer it can swell up and cause something like a mass either in the neck or in the armpits or in the inguinal regions, that is in the leg portion, upper part of the legs. Sometimes their liver size can increase, spleen size can increase, and therefore the abdomen can look big. So these are the common manifestations or the symptoms of blood cancer. So how do we test them? We do a simple test called complete blood count, wherein we look for white blood cell count. White blood cell count can be very high or it can be very low. Both of them indicate that there could be cancer. Sometimes we will be able to see what is called blasts in the complete blood count and peripheral smear, and these blasts are specific for blood cancer and it will not be seen normally. If there are blasts in blood test, then it is confirmed that it is blood cancer. There can be low hemoglobin and low platelet also in association with abnormality in white blood cell count. We also do what is called bone marrow test, wherein we most of the times sedate the child. That is, we make the child sleep with certain medications during the procedure so that the child doesn't feel the pain or remember the painful procedure called bone marrow test. Once the bone marrow test is done, the child can actually walk and it is not harmful. It is not a very dangerous procedure. With bone marrow test, we can confirm that it is blood cancer. We can also confirm what type of blood cancer it is. Now, because blood flows throughout the body, there is no staging in blood cancer like in solid tumors. Instead, there is what is called risk stratification. Based on various parameters, we classify blood cancer into low risk, medium risk, and high risk. In all the three, a standard chemotherapy is available, and this is a set protocol which is used all over the world. Multiple drugs are given at the same time in a particular period as per the protocol. If the child takes this treatment appropriately and in correct doses, whenever it is scheduled without missing even one cycle of chemotherapy, then the chances that the child will be cured of blood cancer is extremely high. What is important is the child should be identified with cancer as early as possible. Now, what is the duration? For leukemia, ALL, it is around 2 to 2.5 years, and for AML, it is around 6 to 8 months. What is the cure rate of blood cancer? If it is a standard risk ALL, then almost 80 to 90% of the children are cured for life from blood cancer. If it is a high risk, around 50% of them are cured. Medium risk is somewhere in between. In AML, the chance of cure rate is somewhere between 50 to 70% depending on what type of cancer it is. Now, what about the children who are not cured? They will require higher treatment like higher salvage chemotherapy and immunotherapy or bone marrow transplantation. Now, how is this chemotherapy given? It is given like any other medicines through the cannula or through what is called central line, which is chemoport or peripherally inserted central line, which is a very safe line to keep in the body. This can last 6 months to 1 year, and through this we can do blood tests also, and we can give injections also. Now, the chemotherapy looks like any other medication, as some of them can be red or yellow in color. So this is briefly about blood cancer. The one message that I would like to give everybody here listening to this video is blood cancer in children is known. It can affect in all age groups, boys and girls. And if it is identified and treated promptly and completely, the cure rates are very high. I hope this video helps you to understand about blood cancer and gives hope to all the parents and the children who have to go through this process. Thank you.